Welcome back to my channel. If you're new here, my name is Dee. I use they, them pronouns, and I talk about things related to my life and being pretty severely disabled. So today we're going to be talking about how to have a successful doctor's appointment. Now, this is something that I personally have a lot of experience with, and I know that going to the doctor is something that causes a lot of people some pretty severe anxiety because it's complicated. There are a lot of details to keep track of, and you never really know what to expect going into it. So my hope is to demystify a bit of that process today. Just as a quick disclaimer, I am not a medical professional, and you shouldn't take anything I'm saying as medical advice. So if you're looking for specific treatment options or anything like that, please consult someone with an appropriate degree and license. Now, first things first, you're going to need to look around your area online for providers who, one, take your insurance, and two, have availability. So there are a lot of places that won't be taking new patients, and they're not going to be able to help you. And oftentimes this information isn't super available on their website, so you may have to call them. Sorry, I know this part sucks. Also, if you're having trouble knowing where to look, your insurance website should have a search function where you can list the characteristics that you're looking for, like gender of a provider, what their specialty is, that sort of thing, and it will show you the options available near you. The only thing with that is you want to make sure that you are looking for providers under your exact plan, because oftentimes insurance companies will have more than one plan available, and you don't want to sign up to see someone who's not actually covered. Now, to prepare for your actual appointment, you're going to want to make sure that you have your legal ID, your insurance card, a list of all of the medications that you take, including the doses, and a list of conditions that you've been diagnosed with. Now, these last two are really only important if you haven't seen this particular doctor before and they don't have your medical record, but it can still be helpful to have those on hand as a reference. The other thing you're going to want to do ahead of time is make a list of the questions that you want answered. So generally speaking, when you go to see the doctor or whoever your medical provider is, not everyone's an MD, and that's fine, you're going to want to make sure that you know what your most important questions are, because really you only get to talk to the doctor for about 15 minutes unless you've booked an extra long appointment. And this is something that is really difficult for a lot of people because it's stressful, it's hard to know exactly what symptoms are going to be most relevant. You don't necessarily know what you're going into or what kind of day your medical provider has already had, if they're paying attention, if they have any prejudices against people like you. There's a million things to keep track of, but really the best thing you can do for yourself and your health is to just stay focused on one or two main problems. That way that you know that they will have time to address them. Now, for the day of your actual appointment, you're going to want to show up about 15 to 20 minutes early. Most doctors' offices will tell you to do this, but even if they don't, it's a good idea, because oftentimes, particularly if you're in a new provider's office, there will be paperwork for you to fill out, and also depending on how busy the place you're going is, it may take them a little while to check you in. You're also going to want to wear loose, comfortable clothing in case they need to do any sort of physical exam. Now, once you get there and you get checked in, usually you will have to wait for a little while in order to be seen. Even though you have an appointment, don't expect that they're going to call you back precisely when it is. A lot of doctors' offices run a little bit behind schedule just because the way the practice is set up, they're trying to see more people in a day than is really reasonable. And that's the American healthcare system for you. But it's not the fault of the people who are there in front of you, so please try to be nice to them. It's good to make sure that you have something to do in case it takes a while to be seen, and also you want to make sure that you don't have anything scheduled right after your doctor's appointment time, because you may be waiting around for longer than you initially thought, And this is something that is kind of unavoidable, particularly if you live in the US. We don't have great healthcare infrastructure, and that's something that makes it more difficult to be a medical provider and more difficult to be a patient. Once they are actually ready to see you, usually a medical assistant will call you back, get your vitals, like your height and weight. You can ask them not to tell you what your weight is if that's something that can be triggering for you. And then they will get you set up in a room, maybe take your blood pressure, and ask you what your primary concerns are for the visit. Be as thorough but brief as you can with them, because you will be asked to repeat the same thing again when the doctor comes in. Now, I know that this seems redundant, and it is. It's intentionally redundant. That way they can make sure that nothing is falling through the cracks. Next, you get to see your doctor or other medical provider. Now, this is the person you want to share all of your detailed concerns with. This is the person who can prescribe medication, give you referrals to other providers, send you to physical therapy, get imaging done if you need it, just a lot of different things that are available to you. Now, you don't have to know what you need in advance. All you really need to do is present the problem that is most important to you and ask any questions that you have as they come up. Try not to be embarrassed or feel as though something is too personal to share with them. As long as you feel safe in that environment, go ahead and tell them anything that you think might be relevant to the situation. It's their job to help you sort through what is and isn't important. If you think you might be nervous during the doctor's appointment, it's totally okay to bring a person with you as support. You can also do things like take notes of what's happening during the meeting so that you can reference them later. Just remember that this appointment is ultimately for your benefit, so do whatever you need to do to feel comfortable in that situation. And also, if the provider themselves is making you feel uncomfortable, you can tell the staff, and you can also leave at any time. There are other doctors. It doesn't have to be this person or nothing, particularly if you feel they're not listening to you or they're behaving in a way that's inappropriate. You don't have to be there. There are a lot of different ways to get the help you need. You're also not required to do any of the things that the doctor recommends. If they tell you to go to a particular kind of therapy or prescribe a medication and that's not something you want to do, you don't have to. All of their recommendations are ultimately suggestions, and you do have the power to decide what happens to your body. If you don't like the things they're suggesting to you, you can ask if they have alternate recommendations. A lot of times there's more than one way to treat a problem. You can also request tests and procedures that you think might be helpful, and if the doctor disagrees with you, you can ask them to explain their position and also note in your chart that they refused those tests or procedures. Hopefully by the end of your appointment, they will have addressed your most pressing questions and you will have a good idea about how to move forward with whatever you're facing. A few things to keep in mind. Doctors and other medical providers are not magical deities. They're just people who went to school for a really long time. So even though a lot of them are invested in perpetuating the myth that they can solve anything to do with the human body, their area of expertise is actually fairly limited, but that doesn't mean they can't help. They have studied a lot, and the things that they have studied allow them to have a pretty solid understanding of how the human body is supposed to work. So even if they're not familiar with your particular problem, they should ideally be able to direct you to someone who has relevant knowledge. Also, for my fellow trans people, or anyone who goes by a name that isn't their legal name, you can have your name and pronouns changed in your doctor's computer system, and that can be really helpful because even if an individual provider isn't necessarily supportive, at least overall they have an idea of how they should be referring to you. So those are the basics. I hope you feel better prepared to talk to your medical provider about whatever's going on with you. I wish you all the best of luck, and I'm proud of you for doing everything you can to take care of yourselves. I'm sure you all have your own medical experiences that you could share. Please feel free to do so down in the comments. Let me know if you have any tips, tricks, advice, anything you felt like I missed, or maybe you disagree with. Maybe you have your own approach about how to talk to your doctor. I'm open to all of it. Thanks for listening, and I hope to see you all again soon. Bye!